stress and strain as the Health Minister has outlined?
Well, look, again, yeah, exactly. I'd just say, that we could have explained it better, but the bottom line is, and the most important thing is, 23 days after a budget, we have come to a process that actually gives us real certainty for the future.
Doesn't the fact that you've announced this 23 days after the budget and the fact that you've booked it against next year's budget actually tell us that this wasn't just a communication error, that you weren't working on the policy and you've had to rush it together because of the public backlash?
No, I disagree. As I've said, we have been wrestling with how best to deliver this, and there was a number of different tracks and ways that we could go about it. Round of new money going in over the next 4 years. So we want to make sure there's good financial management, and we also need to make sure there's good organisational control and a good organisational model, because having 14 layers between the CEO and the patient, if you're a frontline doctor or nurse, what you're hearing is lots of management mush.
Just looking for a number. What's an acceptable loss per month if $130 million is unacceptable?
No, we expect our government agencies to deliver and manage and deliver those outcomes that we've targeted within the budgets that we give them.
So zero.
That's what we're expecting. That's what we're tasking the Commissioner to do.
What is the explanation that you've been given for that $130 million loss deficit?
The explanation we've been given is that disconnecting from the front line meant that we were unable to, or the board was unable to, better align resources with what the frontline needs were.
I get all that, but when were you alerted to the fact they were losing 130 a month?
Well, it was actually in September, October last year.
October?
The previous government, there was what's called an annual report, and that identified a $1 billion deficit at that point in time.
One more on the treaty principles. When you had these conversations in the negotiations, did you understand just how significant the impact would be constitutionally?
Well, I'll just say to you, I understand how challenging it is for people who are on all sides of the debate. But what we are focused on, as you well know as a government, is making sure we are there to improve outcomes for Māori.
Do you accept that it is damaging the Crown's relationship with Māori?
Well, in my conversations with iwi leaders, it's raised. It's certainly a challenging issue. And again, it has been a challenging issue, there's no doubt about it, in my conversations with iwi leaders. But what I'd say is that, I'm in those same conversations, we're talking about the areas where we can collaborate and work together to improve outcomes for Māori. You think about what we're doing with respect to mathematics. When you have 88% of Māori kids at Year 8 unable to read, those are the things and the conversations that we've been getting into.